Hi, it's Debbie Seidel-Bickey, and we're back with phase 2 of the 60-minute Prophy appointment. Last week we talked about data collection and what you do during those 10 to 15 minutes. Today we're going to talk about determining treatment and how your patient will decide yes or no. So follow me through the steps. Phase 2 of the hygiene appointment is what I'm calling determine treatment. And it's possible that you might be 15 or 20 minutes into your hygiene appointment at this point in time. It all depends. Each patient is individually treated, and that data collection can take a long time, especially if you have a new patient or a patient who's overdue, and possibly a patient who has more than just a prophylaxis. So be patient with yourself and know that it's a process of care and that each patient is individual. So you're going to have to adjust the next phase, which is providing the treatment for your patient. I'll talk about that next week. Wanted to step back in history a little bit, because why we're here talking about this process for the process of care for the dental hygiene appointment is all because of Dr. Alfred Fones, who's the father of dental hygiene. And I found this, it's in chapter 1 of Esther Wilkins' textbook. It's primarily to this important work of public education that the dental hygienist is called. She must regard herself as the channel through which dentistry's knowledge of mouth hygiene is to be disseminated. The greatest service she can perform is a persistent education of the public in mouth hygiene and the allied branches of general hygiene. And my, have times changed since 1934. I mean, nowadays we have a lot of male hygienists. I'm not sure Dr. Fones thought that we would have men providing dental hygiene care. And now we know that the mouth is the gateway to the patient's total health. And that's our message during this determination of treatment. What is in the best interest of the patient's total health? So you will sit the patient upright in the chair, knee to knee, eye to eye. Now I recommend that as hygienists, because we are hyper-focused on the perio, what we want to do is talk about restorative and do our restorative exam first before we start into the perio. That way we don't overlook the restorative treatment that's necessary or discovered during the data collection. So again, while you're sitting that patient up knee to knee, eye to eye, and talking with them about the treatment plan, talk about them. If there was a chief complaint, you'll talk about that first. If there was something discovered, I want to eliminate that word found and say, what do we see? We see that there's this lump or this bump, and doctor's going to come and check that during the exam. You're going to talk about the restorative areas. Do they have overdue restorations or aesthetic dentistry that is incomplete? And now what are the words that you will choose to say that add value and reason for that patient to want to pay, schedule, and return for their restorative dentistry and also preventive care with you in the future? And then you'll talk about the periodontal screening exam or your spot probing that you completed that day. You're always going to spot probe before you scale, because once you probe, you know what you're getting into. You know what to expect. It's possible that somebody had a 4mm pocket on their last 6-month visit, and now today, unfortunately, it's more like 5mm. So you're going to sit that patient upright and explain that to him. Do you have intraoral photos? Hopefully you've taken those during the data collection and they're up on your computer screen. If you took x-rays, you can now show those to your patient. Show them areas, maybe they have some calculus buildup or some decay starting in an area, and you can actually show them on the computer screen. When you see something like this on the left, when there's inflammation, redness, there's bleeding upon probing, this indicates that it's more than just a prophy. And so we're going to sit that patient up and explain that. And how are you going to explain that? We have another patient on the right here with some calculus subgingivally. And you might have thought when you looked around that this was a prophy patient, and that's probably what they were scheduled for. But when they came in today, you discover that there's radiographic bone loss and there's more calculus than necessary. What is it that you will say to this patient? Now, in the month of April, I wrote an ebook about value and benefits, and it's on the website under the blog section. But how are you treating these various patients with these various oral conditions, subgingival calculus with bone loss, radiographic bone loss without calculus? You can refer to peri.org so that everybody's on the same team, that the hygienists all understand when it's a scaling and root planing patient, when it's a prophy, when it's a gross debridement, or if you don't even acknowledge the gross debridement, do you use a Reston? All of that can be found at peri.org, and the entire hygiene team can decide what is their philosophy of care for treatment of their individual patients, so that every patient that comes in, whether they see the hygienist Susan or the hygienist Troy, they're all getting the same type of treatment plan when they have this amount of calculus, this amount of pocket depth. That's what we enjoy working with our clients on, so that everybody is on the same team, and each patient, we know how they're going to be treated. For plaque-induced gingivitis, this is one of the most nebulous areas of treatment planning with the hygiene patients. How do you talk to the patient when it's more than just a prophy, but there's not periodontal disease? I wrote an ebook about this, and I have a flow chart in there and some suggestions so that you can get paid and your patients won't be worried about what their insurance is going to pay. This takes all the guesswork out if you download this ebook on this link here on the screen. I sure hope you found these first two steps valuable and provide a much easier day for you as the dental hygienist. Next week we're going to talk about what you do for your treatment, and that will last about 25 to 30 minutes. I'm going to also talk about when doctor will come in to do the hygiene exam. And I've got a little secret for you, so stay tuned for next week. Thanks for joining me.